I will forward the petition to the First Minister and the Deputy First Minister and send a copy to the committee. Thank you. I have received notice from the Minister for Health that he wishes to make a statement. Before I call the Minister, I remind members here in the Chamber that in light of social distancing being observed by parties, Mr Speaker's ruling that members must be in the Chamber to hear a statement if they wish to ask a question has been relaxed. Members participating remotely must make sure their name is on the speaking list if they wish to be called. Members present in the Chamber must also do this, but may do so by rising in their places, as well as notifying the Business Office or the Speaker's table directly. I remind members to be concise in asking their question. This is a ministerial statement and not a debate. Long introductions will not be allowed. I also remind members that in accordance with long-established procedure, points of order are not normally taken during a statement or the question period thereafter. I now call upon the Minister for Health, Mr Robin Swann.
Thank you, Mr Principal Deputy Speaker, and thank you for the opportunity to speak here today on the very important topic of the new 10-year mental health strategy. As we are all aware, mental ill health is one of the greatest challenges facing us today. The COVID-19 pandemic and restrictions to everyday life had and will continue to have a significant impact on our population's mental health. It is currently estimated that the long-term effects of the pandemic may create up to 32% more referrals over the next 3 years. That means more than 19,000 referrals in adult mental health, over 5,000 more referrals to psychological services, and over 24,000 more unscheduled care contacts. This is at a time when our mental health services are already under significant pressure. Inpatient mental health services are under extreme demand, with Health and Social Care Trusts consistently operating above 100% bed occupancy levels in acute adult mental health services. We hear of stories of patients who have to wait for very long periods in emergency departments under PSNI supervision, as there are no beds available in mental health, and of patients on mattresses on floors. Equally, our community mental health services are experiencing increased referral rates and heightened levels of acuity. I have heard stories of patients desperately seeking help without being able to receive the help they need. Patients as young as 8 needing specialist help for eating disorders. Older people starved of human contact without the ability to get help for the mental illness caused by loneliness. Since becoming Health Minister, I have made mental health one of my top priorities. I want to make sure that those who need help with their mental health can receive the help and support they need when they need it. I have shown that it's not just about words and platitudes, but also about action. In the last 18 months, I have published the Mental Health Action Plan, including a COVID-19 mental health response plan, and I have appointed Northern Ireland's first ever mental health champion. I have approved the creation of a specialist perinatal mental health service and managed care networks for both CAMHS and forensic mental health. I have also established a £10 mental health charity support fund and initiated change across mental health services. Across mental health services in Northern Ireland, we have a dedicated workforce that give their all to help and support those in need. I am extremely thankful for their hard work, and in particular during the difficult circumstances of this last year. Going forward, we must equip those working in mental health services with the right tools and systems to ensure that they can help those who need help. We also need to work closely with our partners in the community and voluntary sector to reform our mental health services. And I am therefore pleased to announce the publication of the new 10-year mental health strategy 2021-2031. The strategy sets out 35 actions to initiate reform of our mental health services. It sets a clear direction of travel to support and promote good mental health, provide the right early intervention to prevent serious mental illness, provide the right care and treatment when people need specialist help, and provide new ways of working across mental health services. The strategy is built on a vision of a society which promotes emotional well-being and positive mental health for everyone, which supports recovery and seeks to reduce stigma and mental health inequalities. Our vision sets out the aim for a regionally consistent system that provides equality and equity of service for everyone. We also want to break down barriers so that people are put in the centre. The strategy itself is divided into 3 themes. The first theme, promoting mental well-being, resilience and good mental health across society. That is key to removing and reducing the stigma associated with mental ill health. It provides actions for early interventions and prevention across the lifespan and considers those who care for people with mental ill health. The second theme, providing the right support at the right time, provides services improvements, including improvements across the whole lifespan. It also outlines actions to integrate primary care and secondary care and the community and voluntary sector into service delivery. The theme puts the vision of a truly person-centred care at the core of the reform work. The third theme, new ways of working, provides actions to create system change to allow effective and efficient delivery of mental health services and to promote innovation and research to improve mental health outcomes across our population. While all of the actions in the strategy are important, I would like to highlight a number of them today. Action 2 is to create an action plan for promoting mental health through early intervention and prevention, with year-on-year actions covering a whole-life approach, from infancy to older age. The action plan will consider groups disproportionately affected by mental ill health, who often struggle to access early intervention services, and seek to reduce stigma associated with mental ill health. Action 10 seeks to increase the funding for CAMHS to 10% of the funding for adult mental health services. This will allow for the real service improvement and will continue to ensure increased funding for CAMHS every time adult mental health services receive additional funding. Action 15 will change how mental health services are structured, with a greater focus on the community. This will bring mental health services closer to the person who needs them, where they have the support from family, carers, friends and others. Action 17 seeks to fully integrate the community and voluntary sector into the development and delivery of mental health services. This will recognise the good work carried out outside the statutory sector and bring these valuable partners into the work to improve mental health outcomes. Action 31 will create a single mental health service. This will be done not by removing HSC trusts, rather by supporting them in their work through regional cooperation and consistency. Unfortunately, Mr. Principal Deputy Speaker, mental health services in Northern Ireland have historically been underfunded when compared to other jurisdictions. For example, it is estimated that funding in Northern Ireland is 27% less than in England, 20% less than in the Republic of Ireland, and that is even though the mental health need is assessed as up to 25% higher here than in England. The strategy is therefore ambitious and provides the much-needed reform of our mental health service. However, delivery will be dependent on the provision of additional and sustained funding. To outline the investment needed for the reform, I have also published a funding plan together with the strategy. The funding plan identifies a significant investment need, with the estimate need of £112 to £158 million revenue funding per annum and a £285 million one-off capital investment. The funding plan outlines an investment need of £1.2 billion over the next 10 years to fully implement the strategy. At this level, it is therefore clear that my department does not currently have sufficient funds available to implement the strategy unless significant levels of existing activity are ceased. Additional investment from outside the department will therefore be required to make the strategy a reality. It will require a collected effort across the entire executive to bring about the much-needed reform of mental health services. I am therefore working closely with my executive colleagues to ensure the provision of the necessary funding is prioritised in the next budget process. 4 actions within the strategy have been identified as key enablers. This includes staffing resources in the mental health system for implementation, the regional mental health service, the workforce review and the outcomes framework. My department has identified funds in 2021-22 to initiate these 4 key areas of work, which will set the foundation for the strategy going forward. In conclusion, Mr. Principal Deputy Speaker, it is accepted that the pandemic is having a significant impact on the mental health of our population. It is also accepted that our mental health services are in need of reform. The new mental health strategy I am publishing today is the blueprint for this reform. Before concluding, it is worth noting all the people who have supported the development of this strategy. The strategy is the result of genuine co-production. Over the last year, hundreds of people have been involved in meetings, through workshops, at online events, and through direct communication with my officials on how we can ensure we have mental health services that are fit for the future. This includes service users, carers, professionals, community and voluntary sector groups, and many others. In addition, Mr. Speaker, I want to pay a particular tribute to officials in my department. From the moment I entered the Department of Health, I have been hugely impressed by the commitment, professionalism, and unwavering dedication from the staff within the mental health team. And in particular, I want to commend Thomas Adele, Head of the Adult Mental Health Unit, who has been the real driving force behind this strategy, along with Peter Toogood, the new Mental Health Director in my department. Without their efforts, along with the support of everyone else, the work to develop the strategy would not have been possible. And so I want to extend a huge thank you to everyone who has been involved in the work. Mr. Principal Deputy Speaker, together we can continue to reduce stigma around mental ill health. Together we can improve services and the mental health system. Together we can improve mental health outcomes in Northern Ireland. Mr. Principal Deputy Speaker, I commend this statement to the Assembly.
Thank you, Minister. We now proceed to an hour of questions on the statement. I say an hour, that's the maximum time, and I have lots of members listed, so please focus questions in order that I can get as many people in as possible. One person who will get a bit of leeway is the Chair of the Health Committee, Mr. Colin Gildernew.
Gormaagad, Prior-Lascan Corlia and Gormaagad Minister for this very important statement on a centrally important piece of work. And I would like to also acknowledge the work of your officials and of the many organisations and activists involved in developing this strategy. And we have in committee engaged with both Tomas and Peter on a regular basis and very effectively. So that's to be welcome. I also welcome the indication within the statement that the stakeholders in the charity and voluntary sector will be more centrally involved on an ongoing basis, and I think that's to be welcomed and the right approach as well. So, Gormaagad Marshin. Minister, access to GP services and indeed workload on GPs themselves is increasingly under pressure. However, access to local, accessible and effective counselling services is also difficult and can be a postcode lottery depending on where you live. If the GP in many cases don't even provide counselling services, can you outline how this strategy will ensure that accessible counselling services locally, so that patients don't have to travel large distances to access them? And also, could I ask you for some details on the review into the mental health workforce that you identified there, in particular when that will be complete, and will it have clear recommendations on staff numbers and roles needed going forward?
And I thank the Chair, and I also thank the Chair for his acknowledgement of the engagement that my officials have had with the committee and the engagement the committee has had with the voluntary community sector and bringing forward the publication of this strategy that was done throughout the time while we were also dealing with the pandemic as well. In regards for the workforce review, there is a specific section within the mental health strategy in regards for the workforce review. The outcomes are to present a well-supported workforce that is fit for the future and meets the needs of all those who are mentally ill, and also increase the number of training places for mental health professionals and an increase in the number of staff employed. Over 20% of mental health nursing posts in HSC trusts are currently vacant, and while the number of psychiatry posts is not higher than the rest of the UK, the use of locums to fill those vacant posts is very high, and we actually have a combined locum and vacant post rate of 22%. And whilst locums can fill those duties, that's not the same as having a permanent post as well. So the work is in there in regards to how we fill those posts on a long-term and sustainable system as well. It's also mentioned in the funding plan about the investment that is needed in regards to sustain those posts over the next 10 years is the duration of this strategy as well. In regards to the local level of engagement, there is a desire and there is an indication in the mental health strategy of actually producing mental health hubs which will ensure that provision and support is actually closer to the people who need it in the communities that they need it as well. And that's why we engage in both primary and secondary care delivery in regards to do that as well. So it is about that engagement, about that multidisciplinary team approach that we've seen work elsewhere will also be delivered through those local mental health hubs as well.
Mr Gordon-Lyons.
The statement, and I hope it makes a real difference in the lives of the people that we represent. There are, however, a couple of very stark figures in this document. The first of which is the fact that COVID restrictions and the impacts of the pandemic have had a 32% increase in referrals. I think that is shocking and something that we need to be wary of in this House when we're bringing in regulations. The other, of course, is the huge financial gap that exists in the fact that our funding is 25% lower compared to England, but that our need is 25% higher. We need to deal with that funding issue and we need to deal with treatment, but can I ask the Minister if he agrees with me that we also need to look not only at treatment but at building resilience and early intervention, because that's key to helping people and saving money in the long term. And finally, can I also say to the Minister that the facilities that we have are incredibly important as well. We need 21st century facilities, not 19th century facilities, and to that end, can he give an update on the acute mental health facility that is to be replacing Hollywell? Thank you.
Sorry, just 1 second. I counted 3 questions, and again, if I could just, this is to ensure that people further down the list get their chance. I think that's only fair, and I'm glad to see the member from Northdown nodding in agreement with me. I think it's really right and proper. Minister.
I thank the Vice Chair for his questions. You counted 3, Mr Principal Deputy Speaker. I got 5. But anyway, and look, I'll take them. I'll take them in order, but maybe at a high level, so that other members have a continued chance to ask questions. In regards to the capital programme, again, there is a sustained item within the mental health strategy in regards to the capital investment that is needed. It's 285 million. We do need. It's covered in the funding plan as well, and it addresses the 3 mental health facilities that have already been earmarked for updating and upgrading in regards to where they currently sit. And the member is right in regards to the investment that we do need to see in that physical build and that capital structure as well. So that's why this strategy actually sits alongside the funding plan, because it needs to be that collaborative approach as well. In regards to the impact of mental health on COVID, it has always been something that has been at the front and centre of any decisions that we have made as the Department of Health and recommendations coming forward to the Executive. And as a former Minister, the member will know that in the discussions that has always been taken into consideration, and even commentary and input from the Chief Medical Officer in regards to how we actually take those forward as well. But the funding gap is historic. It's something that this strategy and funding plan, it's something that we all know in this House has been there for a period of time, but it's how this strategy and associated funding plan now sits alongside that to address that gap has been there. But the strategy also sets about addressing some of the inequalities in funding and internally in mental health, and that's why there's that specific commitment in regards to the financial support of CAMHS, so that for the additional monies that comes into mental health, we invest that also in CAMHS as well, so that they get the 10% uplift and support that they also need as well.
Ms Cara Hunter.
Mr Principal Deputy Speaker, and I'd like to thank the Minister this morning for this statement and also for his ongoing commitment to mental health and suicide prevention. It is most welcome. Minister, in the statement it included action point 15. You mentioned a restructuring of mental health services, bringing them closer to the individual who needs them. And with myself, my constituency is very rural. There's limited access to crisis support services, specifically from midnight till morning. So I'm just wondering how action point 15 what will this mean for constituents who are based in a rural constituency? Thank you.
And again, I think the point, because I know it is one the member has often raised in regards to the accessibility of mental health supports. There actually is in the sector as well, or in the strategy as well, at point 50 for certain sectors and individuals, and actually explicitly states the rural and farming community, where mental health is a particular concern, and that's due, as the member knows, to both physical isolation from communities, the worry about the livelihood, the anxiety regarding personal and family safety. And actually research by the Farm Safety Foundation revealed that 84% of farmers under the age of 40 believe that mental health is the biggest hidden problem facing farmers. So it's important to reach out to the harder to reach groups to intervene early and prevent the onset of mental health problems, and that's why we are putting forward under Action 15 that creation of the mental health hubs as well that will be supported to make sure that people can access that support when they actually need it, where they need it as well, rather than having to go elsewhere, so that there is really, in regards to mental health, a no wrong door approach, that people can get the support when they need it.
Mr. Robbie Butler.
Mr. Principal Deputy Speaker. Minister, you're clearly a minister who tells people what you're going to do, then you're a minister who delivers on your promises, and then today you are delivering the good news of what you promised to do. And it's a great day as the mental health spokesperson of the Ulster Unionist Party to be part of this announcement today, Minister. The publication is very, very welcome, and the Minister, I know, is very well aware of the pressures in particular around children's and adolescent mental health, and I know the Minister will also recognise the sterling work done by Pure Mental NI and Crisis Cafe, amongst other young groups. But can the Minister inform us as to what commitments form part of the strategy that might help to transform children's and mental health, adolescent mental health services, please?
And again, I thank the member for his point in regard, and I mentioned earlier in regards to when I was answering the Deputy Chair of the Committee in regards to the funding for CAMS. There are a number of actions within the strategy that's actually designed to improve support for children and young people with mental health needs, and that's promoting positive social and emotional development through childhood, to provide enhanced and accessible mental health services for those who need specialist support, and that includes children and young people with disabilities, their families, their parents, but also includes that commitment for increased funding for CAMS to create a clear and consistent urgent, emergency and crisis services to children and young people. Mr. Principal Deputy Speaker, my team worked closely with organisations such as the Northern Ireland Children Commissioner, the Princess Trust and Action Mental Health during the development of this strategy and the consultation to ensure that children and young people were involved, and a children and young people's version of the strategy was also produced to encourage and facilitate the engagement and involvement of children and young people in the consultation process.
Ms. Paula Bradshaw.
Deputy Speaker, and thank you, Minister, for the statement today. I look forward to reading the blueprint in more detail later today. You mentioned there earlier about the mental health hubs, and before I entered politics full-time, I worked in the community sector and was aware these mental health hubs were being set up. Part of the issue was that there was a lack of resources and a lack of support then when people came forward. I'm just wondering, are you satisfied enough money will be put into these hubs to make a difference? And also, what engagement have you had with the Department for Communities Minister around additional funding for the community and voluntary sector, because they have a vital role to play in terms of dealing with issues such as isolation? Thank you.
And I thank the member for her question in regards to the funding of the mental health hubs. It is laid out in the document that runs aside this, and in regards to the funding plan, about what that financial commitment will be recurrent over the 10 years. As I said today, while I've published this, it doesn't indicate that I have the funding at the minute to deliver it as well. So while this is about the direction of travel that I was asked to undertake and produce, that's what we have done. But it's also now about seeking that further investment, long-term investment, recurrent investment in all the aspects that need stepped out over the next 10 years to provide the support and the change of service that we actually need. In regards to the support of the voluntary community sector as well, I have ongoing conversations with the Minister of Communities and how we can further support those. But the member will also be aware that I announced a £10 million mental health support fund that will open on Monday. The fund is open to all charitable organisations that offer support services to people with mental health throughout Northern Ireland, and groups will be invited to submit proposals on themes which are key supports to mental ill health as a result of the COVID-19 pandemic, and which also strengthen the person-centred approach in the new 10-year mental health strategy. So that funding also ties in with the work that we've announced today.
Mr. Jonathan Buckley.
Minister for his action plan. One of the most startling elements of this statement is the estimated 32% increase in mental health referrals due to COVID and the restrictions. But it's fair to say that it's not just legacy restrictions. Indeed, current restrictions are still having a terrible impact on the mental well-being of many of our citizens. Just last week, I had a distraught constituent who could not visit their mother, who was very gravely sick in hospital due to restrictions in that hospital. This is not the first instance that I have had of this. Will the Minister intervene and end this visitation fiasco, which is having such a devastating impact on the mental well-being of many of our citizens who are already at a very difficult situation regarding the health and well-being of their loved ones?
Visitation is something that we keep under constant review. The next review is due on the 9th of July in regards to where we see the current pandemic and make that risk assessment. I do want to correct the member. I did not say the 32% increase in referrals was due to restrictions. I said the 32% more referrals over the next were the effects of the pandemic. So there is a complete and justifiable distinction between the mental health effects of the pandemic and what the member is actually trying to allude to, that all that was caused simply by the restrictions that were put in place.
Ms Liz Kimmins.
I thank the Minister for his statement this morning. Minister, supporting those with a dual diagnosis of addiction and a mental health condition has been a long-term failing, and I know my colleagues Carol Cullen and Orlia Flynn have raised this issue numerous times. I note the draft strategy mentions creating a managed care network. So can I ask the Minister, what assurances can you give that in a year's time those who are accessing this managed network will see an improvement in their lives who after being repeatedly let down?
And I think the member talks about what will happen in a year's time. Can I ask her for her support with her party colleague, especially the Finance Minister, in ensuring that in a year's time that I have the funding commitment that is also set out in the funding plan, not just for a year's time, but the 10 years' time that is also set out as well in regards to what we need to do in the entirety of this strategy. In regards to dual diagnosis, which the member and a number of her colleagues have raised with me and raises often, there is a specific section in the mental health strategy from point 183 onwards where we do look at the outcomes of a concurrent mental health issues and substance use, and what the outcomes actually target in regards to this strategy are a reduction of patients with concurrent mental health and substance use and non-compliant with mental health treatment, a person-centred approach to care that focuses on the person rather than expecting the person to fit into the system, better health and social outcomes for those with concurrent mental health and substance use issues, and people with co-occurring mental health and substance use issues receiving high-quality, holistic and person-centred care. The strategy also states the dual diagnosis guidelines are clear that services should work collectively to address the needs of the person. And again, I get back to that comment that we do want to focus in regards to this strategy, that a managed care network will be created to ensure that there is a no wrong door approach and that the person receives the support they need when they go to the first door.
Ms Nicola Brogan.
I thank the Minister for his statement here this morning. Minister, first of all, I'd like to welcome your earlier commitment to include infant mental health into the overall strategy. But in relation to the funding of the strategy, and in particular the £285 million one-off capital investment, can you outline where the capital investment is going? Is it into a perinatal mental health unit, an eating disorders inpatient unit, or maybe even the acute mental health unit in Oma that was agreed back in 2016?
I thank the member for raising the last point, and I think I heard the tail end of her petition yesterday in regards where she referred to the 400 million as a sticking plaster in regards to what we are doing in regards to the mental health facility in Oma. It's necessary work to bring that facility up to a standard that is acceptable at this minute in time. The 285 million, as she will be able to see later in the funding plan, goes to that commitment of the wider capital investment that we need to put in place. There's a majority of it is actually earmarked for the 3 mental health hospitals that have been identified across Northern Ireland and the input that is given there. Part of that is the Oma facility that the member has called for and submitted the petition yesterday, which I haven't received yet, but will respond formally to her on that.
Mr Mark Durham.
Thank you, Mr Principal Deputy Speaker, and I'd like to thank the Minister for his statement that signals a very positive step forward in our long-running battle to reform mental health services, to make them more widely available, to make them more accessible, and to ensure investment in mental health. It's a massive issue here, a massive problem here, and one that must never again be swept under the carpet and suffer from chronic underinvestment. The challenge for all of us and for all departments is to make sure that departments don't just buy into this, but that they also pay into it. Minister, what confidence has the Minister got that departments will work beyond their silos, and in particular that the Department for Education will ensure that building mental well-being and mental resilience are central to our children's education?
And I think the member for that point, well, 2 points there in regards to the investment. In our young people, there is a section specifically again in the strategy in regards to the support of young people from the age of, from early years onwards. In regards to that, and the member will also be aware that recently the Minister of Education and myself co-funded a support package into schools. Education put in $5 million, and we supplied $1.5 million for that support as well. So this is about early intervention, which actually leads to prevention as well. In light of this, Action 5 in the strategy seeks to expand that early intervention process as well. And the strategy also highlights the use and delivery of alternative methods of therapy, including art therapy, music therapy, incorporating different methods of delivery in our day-to-day models as well. In regards to the financial commitment, again, I listened to the Minister of Finance yesterday when he made that statement about how health was an executive priority. Mental health is a Department of Health priority, because we do have to rebalance the imbalance that has been there over the past number of years in regards to both investment in our facilities, but also investment in the workforce and funding for the work that needs to be done. So there is a challenge, there is a job of work to do, and that's why we deliberately set about not just publishing a strategy, but also the funding plan that needs to deliver that strategy. So it's not just a document that sits there in an abstract, but we can actually see what the money is needed for, where it can be invested, but also the outcomes that come out of that investment as well. I do acknowledge the Minister, or the Member's Minister from the Minister of Infrastructure, has already committed that if it's necessary for surrenders to be made in different departmental budgets, that the Member's Minister is up for that, so we can get health back to where it should be in Northern Ireland.
Mr Alan Chambers.
Deputy Speaker, can I put in record that it is to the Minister's credit and that of his staff that his department can bring forward such an important piece of work while still dealing with the COVID pandemic and all the associated consequences of that. So I thank the Minister for his statement this morning, and for the first time it appears we have a Minister who not only recognises the historic underfunding of mental health services, but who is prepared to take action to rectify it. The strategy has a big financial ask, and other speakers have alluded to that this morning. Is the Minister confident that he will have the full support of the rest of the Executive to deliver on the actions and improvements within it? Thank you.
And again, I thank the member for his point. In regards to my opening comments, I referred to the times for warm words and platitudes to be over, and that's what this action plan was about. It's also what this funding plan is about as well, so that I can present to ministerial colleagues the financial need, the financial ask. This strategy has been costed by my department officials as to what it needs to actually deliver it. I will continue to have engagements with ministerial colleagues in regards to the necessity of investing now, and it really is about investing to save, because we have to invest now in the mental health and well-being of the people in Northern Ireland, so that we don't see those increasing pressures and waiting lists actually expand in regards to the mental health needs of the population of Northern Ireland.
Mr Pat Sheehan.
Minister, I have been engaging with school leaders in my own constituency over the past number of months, and it's clear that the mental health support system within our schools is under considerable pressure. It was under considerable pressure. It has been made all the more worse now as a result of the pandemic. And given that mental health in our schools is a cross-cutting issue, could you tell us what engagement you've had with the Health Minister or Ministers over the past while? And what are you going to do to ensure that our young people get the support they need within the school system?
And again, I thank the member for his point in regards to, I suppose, the knowledge he now brings, having transferred from health into the Committee of Education, in regards to what work can be done across the system as well. Within the mental health strategy, there is a section specifically about young people in regards to, as I said earlier, that no wrong door approach, especially for CAMS. So that Action 12 is actually there, that we create a clear and regionally consistent urgency and emergency crisis service for children and young people should we get to that stage. But what the member talks about is that investment that we as a Department of Health and the Department of Education can do together. A number of months ago, as I said in an earlier answer, we did announce that joint funding package for the mental health supports within schools. £5 million came from the Department of Education, supported by £1.5 million from my own department in regards to that supports. That's the first step. That's an investment in the mental health and well-being of our young people, so we can build in that early age resilience as to the fact that they know now that mental ill health is not a stigma that needs to be hidden, and it's something that they should be talking about should they feel the strains and pressures that they come under now, strains and stresses and pressures that weren't there when the member and I were that age as well, because of the changes in society, of social media and all the additional pressures that are currently there that we didn't have to face at that age.
I dare not venture a guess as to when that was that you were that age, Minister, but anyway. Mr Stuart Dixon.
Thank you very much, Principal Deputy Speaker, and thank you, Minister, for your statement. Very important today, as Northern Ireland has fallen dramatically behind in terms of mental health care. Minister, can you tell us what engagement you've had with the mental health strategy developed by the Elephant in the Room Youth Mental Health project and the recommendations which they have brought forward specifically around mental health and young people?
And I thank the member, as I said in the statement earlier on, my officials have engaged widely with a number of stakeholders and different groups in regards to the consultation and engagements that we've actually had in producing not just the strategy but also the action plan as well. In regards to the Elephant in the Room, it was actually a group that was first introduced to me by the member's party colleague, Chris Little, as Chair of the Education Committee. And one of the things that we were able to do at that point as well was actually to bring them to present to the Executive Subcommittee on mental health, resilience, wellbeing and suicide prevention. So that organisation has had, I suppose, direct input into not just how we developed and how we've worked around this strategy, but also into that subgroup of the Executive as well. And then they had follow-up meetings, I think, with the Minister of Communities, Karen McCullen, at that point in regards as to specifically how she could support the work that they were doing as well.
Mr Justin McNulty.
Minister, I welcome the statement. I hope the initiatives, which are very important, will produce important positive outcomes. Often we see a lot of focus on physical conditions, but mental health is the unseen condition that, as my colleague has said, has unfortunately been swept under the carpet for too long. I appreciate the commitment to additional support in CAMS. Can the Minister assure me that children in schools will not be forgotten about? Before they've become to have mental health issues, can they be taught the resilience that's so important to prevent these issues becoming impactful in their lives, and through sport and education, how important roles can they play? And for those children and young people who are suffering from learning difficulties, who have suffered throughout the pandemic, people like the Taylor boys in Armagh, their mum Catherine, who have had no access to respite and whose mental health has deteriorated enormously, their families as well. What supports are in this for them?
Again, I thank the member for his point in regards to respite, and the member will be aware it was an issue that was covered in a debate recently here in the House. In regards to the strategy, Mr Principal Deputy Speaker, it actually covers where we want to go and what we intend to do with child and adolescent mental health as well. The outcomes that are envisaged within this are supports for infants in child and adolescent mental health service, where children and young people should receive the care and treatment they need when they need it, without barriers or limitations, and this should be evident through shorter waiting lists. And that also includes about an outcome for a reduction in difficult transitions for children and young people by improved outcomes in 10,000 more voices and similar user surveys. But it also looks, and I think what the member refers to, is that a regional approach to the delivery of child and adolescent mental health services, which we're currently not seeing now because there is a different level of delivery across our different trusts, and that's why one of the key aims of this strategy, and one that we're able to commence with the current funding that has been committed by my department, is that about how we look about a regional service to deliver that consistent approach across Northern Ireland.
Ms Rachel Woods.
Mr Principal Deputy Speaker, and I thank the Minister for his statement today, and I look forward to reading the strategy later on. I also look forward to the funding being allocated too that is clearly needed. I want to bring the Minister back to dual diagnosis and ensuring that people who have co-occurring disorders are receiving the support they need. So can the Minister outline how the actions in the strategy tie in with the substance misuse strategy and ensuring that those with dual diagnosis, especially in relation to people accessing housing, because you'll be aware that that is an issue, and how will this be part of the joint working envisioned?
And again, I think the member, she will know the substance use strategy is actually mentioned, well, she will see the substance use strategy is actually mentioned in regards to the specific sector we have in regards to dual diagnosis within this strategy as well, because they're all strategies and pieces of work that are coming forward from my departments. We've made sure there is that crossover as well in regards to dual diagnosis as well. Because as the member is fully aware, in regards to dual diagnosis, service users often report difficulties in accessing services with unclear lines of referrals. So the response that we want to envisage from this must therefore ensure that mental health services and substance use services consider the patient first and adjust the system to fit the patient rather than expecting the patient to adjust to fit the system as well. So that's laid out within the strategy as well, and I thank her as well for the comments in regards to the funding as well, because I will do my utmost to ensure that this strategy is funded as well, as will, I hope, will all the executive parties, but also all the other members within this House as well, in the support of the vital work that this strategy sets about doing to deliver for all the people of Northern Ireland.
Mr Tim Allister.
In regard to the estimate of an extra 32% referrals arising from the pandemic, if it doesn't include those resulting from lockdown, what is that figure? And if it does, what proportion of that arises from lockdown? And is there any acknowledgement on the part of the Executive that the severity and duration of the lockdown in fact adversely contributed to mental health, as to cancer services and everything else?
I thank the member, and maybe Mr Principal Deputy Speaker, to clarify the point. The 32% referrals is of the effects of the pandemic, and that will include some of those who have suffered from the effects of restrictions and regulations that have been put in place, because we are aware of the impact that it has. And if you refer back, and the member will be able to read back in Hansard what I actually said in my opening statement, if there was a misconception in response to Mr Buckley earlier on, I'll correct that quite happily in the record, Mr Principal Deputy Speaker, that 32% includes all the long-term mental effects of the pandemic. But I do want to point out to the member, when he talks about the Executive's decision, I do have to identify that these mental health impacts are not just being experienced here in Northern Ireland, they're being experienced across the United Kingdom, the Republic of Ireland, and in every other country where this virus has had serious impacts on not just the physical health of people, but also the mental health of people as well. Because we have never faced in our lifetimes a pandemic like this, and I hope that we never have to face it again, where we have had to take the decisions that we have taken as an executive. We haven't taken them in isolation, as many people in this House seem to indicate that we were doing something that was solely unique to Northern Ireland, because the decisions we made were what we were seeing being replicated in many other jurisdictions. And as I said to the Vice Chair of the committee in his response, when coming forward with these recommendations, the Chief Medical Officer always had his input in regards to the societal and mental health and well-being of the population when these decisions were being taken. There was also a considerable piece of work in regards to the cohort that we actually asked to shield during the first wave of the pandemic, and we actually asked the Patient Client Council to engage with those people in regards to indicating what mental health and additional mental health strains they were experienced due to shielding as well. And that was part of the feedback that we took into consideration when coming the second wave, that we didn't go to such an aggressive stance in regards to shielding that community as we had in the first stance.
Mr. Jerry Carroll.
Thanks, Minister, for a statement. Minister, you referenced heartbreaking cases of people under 8 years of age, needing specialist treatment for eating disorders. The mother of a young person recently in contact with me about her child being severely distressed and forced to wait months to get access to private services because the NHS and trusts are so overwhelmed. It seems to be, unfortunately, commonplace. Question I want to ask the Minister is around funding. The statement states about needing £1.2 billion of funding. I suggest it's probably greater to tackle the pandemic of health and mental health crisis over so many years. Where does the Minister envisage this money coming from? There's been some suggestion around waiting lists that we take from services here, the fund waiting lists here. I would suggest that is a short-term and misguided strategy, and I suggest looking at those who have financially blossomed during COVID would be a better strategy. But where does the Minister see the money to fund this coming from? Thank you.
I thank the member for his point, and in regards to where I've been clear in this isn't about having to shift funding within the Department of Health. There's no point of me robbing Peter to pay Paul to deliver for a mental health service while at the same time then underfunding or reducing the funding and support to another part of the health service. Over the last number of statements that I've made to this House, Mr. Principal Deputy Speaker, in regards to elective care, in regards to or no more silos, in regards to the work that we see now needed done in the mental health strategy, it indicates of 10 years of underinvestment in the entirety of our health service. The 1.2 billion that we now need, that we've indicated that we need over the next 10 years to correct that underfunding, is the cost that we paid for those 10 years of underinvestment. If we'd have kept level or kept at least with a realistic service provision and support mechanisms over the past 10 years, that need now would not be so big, even in regards to the capital expense that we need to have. So in regards to where do we see this is about tough decisions and tough conversations at the executive level. If our block grant is not increasing from Westminster, there is a need that we find this money and we invest this money in the people of Northern Ireland. You don't have a sustainable workforce if their neither physical or mental health allows them to go to work. You cannot have a sustainable education service if the children attended or if the teachers or the people supporting them are not physically or mentally able to carry out the work that they need to do. So we need to invest in our health service for the future and for the direction that we need to see Northern Ireland actually travel in, where we can support an education, where we can support our economy, but we have to do that with a healthy, both physically and mentally health able population, and we start that now by investing in this strategy and delivering the 35 outcomes that have been indicated through the co-production and co-design.
Ms Gemma Dolan.
And I thank the Minister for the statement. Minister, as part of the Sinn Féin submission to the strategy, we highlighted the lack of reference to actions to reduce long-standing and ingrained health inequalities. We know we need population level changes, but we also need targeted interventions. Minister, what actions are dedicated to reducing mental health inequalities?
I thank the member for her point. In regards to the specific inequalities, there are a number of specific groups that have been identified in regards to where we have to tackle. In an earlier answer, I mentioned our rural population as well and how that needs to be addressed. At point 54 in the strategy, we need that renewed focus to ensure that mental health promotions actually meet the needs of early interventions, and that includes the targeted approaches to groups more likely to be adversely affected by mental ill health, and that's such as the BM groups, refugees and asylum seekers, people with a specific trauma exposure, LGBT+ people, people with a physical or sensory disability, persons with an intellectual disability as well. And that's actually, it is actually one of the leading actions, and that's at Action 2 of the strategy itself, and how we actually identify those individuals, but also promote mental health through early intervention and prevention, with year-on-year actions covering a whole life approach.
Thank you, Minister. No other member in the chamber is indicating to me that they wish to ask a question. So if members would take their ease for a few moments, we'll move on to the next item of business shortly, which is the Charities Bill. Members, just take their ease. And if you're leaving the chamber, don't forget to sanitise where you were. Thank you.